blue Medicare card when you're seeking services, and then you would submit your new ID cards to any provider or pharmacy. And then in the situation on being on most of these plans, if you were to take the MedX plan with the Part D plan, your out-of-pocket exposure would be only for drugs. But for those who would take the Managed Blue for seniors, it would be some co-payments, as we discussed. And like I said, let me hold these, and we're going to go through it, and we'll get back to them. We won't ignore the question, but let's go through some of the formulary piece, okay? When you take a look on the front, it tells you what it is, again, a Part D plan for you, and the first 5 pages are the most important for you because they ask you a few questions and give you a few comments on it and how to use it. What is a formulary? We talked about that. How are the drugs listed? Now, how many of you are retired teachers? You didn't design this book, okay? Nor did I, because it's by medical condition. It's alphabetically listed in the back, all right? And then it's listed by condition. Not all of you know exactly what drug equals what condition. Even I sometimes go, I don't know that, all right? But think of hypertension as a condition, and then the drug itself associated with it. Sir, yes?
We receive a weekly supply of oxygen. 80% of it is paid by Medicare. Now, the secondary company will provide up to 20% of the bill. Do we have to notify them, or does it automatically continue and they notify you?
You need to notify them, any provider, of your new insurance effective July 1st. So that's the way to notify the company, whether it be an oxygen provider, whether it be a pharmacy, a primary care doctor, a specialist, new ID cards for July 1st. So in your situation, you would tell them of your new plan, okay? It's effective July 1st. The cards, and we'll get to that too, we'll get back to the formulary, and then we'll get to the process, I promise. The cards come pretty much the middle of June, effective for July 1. I know I'm losing some folks here, so I want to come back to it, back to the formulary, and then we'll talk about some of the logistics. So, generic drugs, you know what those are, we've mentioned them. Restrictions on coverage, that tends to be where the most amount of questions come in, and where I can see some of you saying, Monica, I might have had a prior authorization. Monica, I might have worked with my doctor on this. That's on page 2, where it talks about prior authorizations, quantity limits, and step therapy. Is every drug covered for 90 days? We answered this previously, but just in case you didn't hear it. Can every drug be filled for 90 days? No. Some have addictive qualities about them. Some you need to check in with your doctor. Some drugs do need prior authorization or frequent communication, and some drugs are associated with what I call step therapy. It's called going up or down the ladder, and I spoke to a woman earlier about a medication she takes. She's tried generics. She couldn't use them, so she had to go up to a brand name or a non-preferred. Or some people find out they're on the most expensive class of the drug, and then a generic becomes available, and then they step down the ladder to try that drug. That's step therapy. In using this formulary booklet on page 3, what if your drug is not in it? Sometimes there's a generic name for a drug that you might not know about. Don Cummings with Blue Cross and I laugh frequently because sometimes we even Google the drugs. Did you know that you had a generic, or has your doctor talked about it with you in the past 20 years? There may be a generic available for a drug that you